Have you ever had therapy before?
I had therapy before. Didn't go well.
When I was in the first two therapy sessions, or first two therapists, I don't think they had the right training. So I've had a therapist tell me, well, you have autism. I've never dealt with that before. I've had a therapist tell me straight off that.
It is estimated that approximately a third of individuals with intellectual and developmental disabilities have a concurrent mental health concern, such as depression, anxiety, or trauma-related disorders, among others.
My name is Michelle Maddox, and I am a licensed clinical social worker. Intellectual disabilities as a whole, oftentimes the disability kind of overshadows the mental health diagnosis. Specifically in the Down syndrome community, there's a myth that people with Down syndrome are always happy. So maybe, therapists don't really think of that population as a group of people that are in need of mental health services.
People need help in this world, and everybody has struggles. There's no such thing as one person struggling. Everybody needs help.
It's hard for people with disabilities sometimes because the way they talk and the way they speak, and sometimes their even needs itself, make it difficult for them to advocate for themselves in therapy. Some people may not even think they need it.
We have feelings and emotions ourselves, and we have pressures. We have stressors in our everyday lives, mentally, physically, because of expectations on us to be who we are.
So the goal of therapy a lot of times is just to help them identify the goals they have for their life, how they can get there, and introduce them to some coping skills and calm down activities that they may not have learned about throughout their life.
Learning about breathing more, and meditation more.
I had, as I said, depression issues and anxiety, and sometimes I would have anger issues too. She was able to help me cope when I needed it.
The communicating more and helping with emotional help, learn how to handle feelings better, and learn how to process everything better when it comes to different types of feelings or emotionals, and just take the time and being patient with it.
I don't like when I see people who can't live their own life because of their own disabilities. I don't think that's right at all. Any person should have the right to live their own life, make their own choices, and if they need support, there's always support out there.
Additionally, people with ID are 3 to 4 times more likely than people without ID to experience adverse events, such as abuse, neglect, and medical trauma.
Even though, and I guess this is good for therapists to hear too, you might not think you're making a difference or nothing's really sinking in, then I'll hear stories from families like, oh, they were telling me about so-and-so that you talked about, and they want us to practice doing this activity at home. I think that's a good reminder, like I said, for therapists, that you are making a difference. It might just take a little bit longer to see it in working with this population.
That's why I'm here today, because I'm able to function because of what they were able to help me with.
I hope that therapy can help me communicate better with my friends and loved ones so that they can understand me better and helping me deal with the emotional aspect of it.
I think that meeting someone who does have something that's different from what you've experienced is good and a learning experience.
Just promoting inclusion so that we can see people with disabilities out in the community and that we can recognize their abilities and that we're actually more alike than different.
Going into someone who is nervous about working with people who in mental health who do have disabilities, treat them as if they're like you and as if a story, and listen to their story.
It's nice that clinicians can see the human and not my disability.